Now that we have defined structural racism, we would like to examine its impacts. We will look at the ways racial inequities manifest themselves on a national scale. This next section will take a look at some contemporary racial disparities in various aspects of our everyday lives. The first area that we'll examine is healthcare. In healthcare, we see racial disparities in both access and outcome, resulting in shorter life expectancy among Black and Native American people compared to all other racial and ethnic groups. Many of the disparities we'll discuss here are affected by a range of inequities across systems, reflecting the structural nature of racism in the US. For example, Black, Hispanic, and Native American people are more likely to be uninsured than white and Asian people. While the percent of people without insurance has generally decreased over time, significant disparities persist. For example, in 2021, the uninsured rate among American Indian, Alaska Native people was 15 percentage points higher than Asian people. As of 2021, 1 out of 5 Hispanic people and 1 out of 5 American Indian, Alaska Native people did not have health insurance. Black people and Native Hawaiian Pacific Islanders have an uninsured rate of 11% in 2021. What's interesting about this graph is that the steepest decline in the uninsured rate occurred when the Affordable Care Act passed and there was broad Medicaid expansion. While the ACA helped millions of people access health insurance, it was not designed to reduce gaps across race and ethnicity, which is why significant disparities between the white population and virtually all other groups remain. Lack of insurance coverage has a significant impact on access to affordable healthcare or any healthcare, which can be particularly devastating when a health emergency arises or in the case of a global pandemic, as we have just collectively experienced. In fact, during the COVID-19 pandemic, people of color were hospitalized at a higher rate than white and Asian people, and even died at higher rates than white and Asian people. Beyond the devastating health impact of the pandemic, people of color were also impacted by practical aspects of the pandemic. For example, less than 20% of people of color were able to telework, compared to 24% of white people and 38% of Asian people. Here we can see the interconnectedness of systems, where healthcare and quality of life intersect, particularly since people who could not work remotely during the height of the pandemic were also likely more exposed to COVID-19, resulting in these disparate health outcomes. When it comes to pregnancy and childbirth, all women are not having the same experience or outcome. Who are the women that you see here? At the top, we have one of the best tennis players of all time, Serena Williams, and below we have the music superstar Beyoncé. They are rich, they are famous, and they have access to all of the best resources. And yet, they both face the same realities that millions of Black women and women of color face in the United States. Both Beyoncé and Serena Williams experienced complications from their pregnancies that put their lives at risk. Serena Williams famously shared her harrowing experience whereby she was at a risk of blood clots and was concerned about her health post-delivery. Despite her concerns, her medical team dismissed her and would not listen to her and her needs. The Center for Disease Control and Prevention warns that Black women are 3 times more likely to die in childbirth or pregnancy-related complications. The CDC explicitly states that structural racism and implicit bias contribute to these racial disparities in maternal health. We often blame women for their behaviors, what they eat, what they did, what they didn't do. But what the medical community is increasingly becoming aware of is that women of color are largely impacted by interrelated systemic issues, from lack of adequate healthcare during pregnancy and beyond, to implicit bias and mistaken assumptions about Black women's ability to withstand more pain than other women. Additionally, this impacts children, as Black babies are twice as likely to die than white babies.